Welcome back to Weekend Express. We're focusing on your health now this morning. The World Health Organization has reported that cases of cancer are on the rise worldwide. What could be the causes to this, and how can you prevent yourself or protect yourself from the rising cases of cancer? Well, in studio for this conversation is Dr. Chirag Shah, who is a cancer specialist from Apollo. We also have Maj Kariche, who is the director of the Apollo Information Center. Many thanks for joining us on Weekend Express. Dr. Chirag, let's begin with you. What is the reason behind this alarming report by the World Health Organization that cases of cancer are on the rise?
So it's a number of factors, but the big ones are the tobacco, which contributes about 30% of all cancers. And then I think that is known to a lot of people, tobacco. But what is lesser known and what is becoming increasingly important is the lifestyle changes.
Right.
And that has contributed to additional 20% of cancers, apart from few other issues like alcohol, which is about 5% of all cancers. And then some infections like HPV. So those are the big reasons, and the sudden change that we are seeing is related to the increasing tobacco consumption and the lifestyle.
All right. And when you talk lifestyle changes, what really are we talking about? Because one would say not everybody consumes alcohol. We have 2-year-olds or 3-year-olds, infants with cancer. What could be the cause for, cancer, especially in children that age?
So when you say cancer, it's not one disease. Like we don't say what is the cause of fever. We ask, we understand that fever are due to many different infections and their sources are different.
Right.
Similarly, when we say cancer, there are over 250 different types of cancers. And the reasons are different for different ones. About 50-60% of cases we know the reasons. In another we don't know. And the children cancer are among those where we don't have a handle yet as to what are the reasons.
Right. So when you talk about lifestyle changes, then it makes the question of how one then should live their life. When you talk about alcohol, for example, does it mean total prohibition of alcohol, or does it mean one can consume alcohol to a certain limit? We've also had concerns about red meat. Does it mean not taking red meat whatsoever, or are there certain types of red meat we can take? Marge, maybe just to get your thoughts on this.
I think about the lifestyle, the food, white meat, Dr. Chirag, you had mentioned. We avoid processed foods like sausages, a lot of meat, red meat, and alcohol. Yeah.
So when you say avoid, completely take it off your menu?
No, not completely. I mentioned this in my talk that, see, we have come to a point where we cannot go back to 18th century living. But the idea is that all of us should try and think what our grandparents did. It's a very simple way to figure out a good lifestyle to a large extent. So if you think about that, they had a lot more exercise, a lot more than what we do.
Right.
They had a lot less calorie food, high calorie food. Meat was a delicacy. You did not have meat so easily available. Okay? Then same way alcohol was available, not every day, not in so much amount, at festivals, at weddings, not every day. So now that we have so much food available, so much of everything available, we are eating lot more, but we are spending less. The calorie intake is much bigger and the spending is much less. So that's sort of in a nutshell, you can say about lifestyle. And then there are lots of different points. I had put out 3 slides that day on how our lifestyle has changed, which includes so many other things. A simple example which we don't think about is how we sleep. Okay, so we sleep a less than earlier. It's very late we wake up late, sometimes we wake up early because of work pressure.
So what would be the recommended duration of sleep one should get?
So one, for children, for very young children, it is about 10 hours. And for adults, it's 7 to 8 hours. And as you get 60 plus, it can be less.
How does this increase chances of getting cancer?
Okay.
Lack of sleep.
Right. So lack of sleep is associated with obesity. And obesity, or being overweight, is a big reason for cancer. Very clearly proven for several common cancers, including breast, prostate, colon, uterus. These are the common lifestyle associated cancers. So when we say lifestyle, it is lot of things interlinked. So it's not that everything is direct. The another very important point is very new research that if your overnight glucose level is high, you have a higher chance of cancer. So what happens if we don't sleep at time? We are watching TV, we are munching, right?
Right.
Or we are drinking something. So that gives us a high sugar level overnight. So the lifestyle is a lot of these things put together.
Right. And you mentioned in one of your books, your publications, that infections could also lead to cancer. What kind of infections are we talking about that when left unhandled or when they get out of hand could cause cancer?
So the big one which a lot of people know is HPV, human papilloma virus, which is the cause of cervical cancer in 95% of cases.
Right.
Okay? So that's one very big infection. The second is hepatitis B, which is the cause of liver cancer if left untreated. So those are the big ones, and then there are smaller number of cases related to, say, H. pylori causing lymphomas and a few other very rare ones. Then HIV is also increases the risk of several cancers, including lymphomas and cervical cancer both.
Right, and of course, the biggest problem when it comes to cancer is detection. Early detection, of course, would lead to, in many cases, being treatable, but there are no warning signs when it comes to cancer. There's a lot more types of cancers now emerging. So even when you know the symptoms of cervical cancer, for example, you might have, I had a case of jaw cancer just the other day. So where does one begin in terms of really just having those regular checks and making sure they prevent every kind of cancer possible?
So let's focus on the big common cancers rather than every type of cancer. What happens when we start talking about everything, it gets too complicated.
Right.
And then people get confused and say that, oh, it doesn't work and there is no point trying to find or think about it.
Yes.
So the first thing is you have to know your body. The awareness of your body is most important. So body does give signals. When we say cancer does not give warning signs, that is not right. In majority of cases, there are some warning signs, but they are more subtle compared to, say, infection which gives fever, big pains, body aches. So yes, not like that, but it does give signals. The big signals that you can think of and remember are that if there is an ulcer in the mouth or anywhere in the skin which is not healing for several weeks, okay, when you think of that. If there is a change in the voice, now any of these symptoms should be lasting 3 to 4 weeks persistent. We don't go to the doctor for 1 week of throat, voice change. Then difficulty swallowing food, okay. Then for breast, you have a lump, and remember these are painless lumps. So the reason people avoid going to doctor is because it is painless, so they can bear with it. So the body is giving signal, but it is not kind of urgent signal. You can handle it, so you keep on postponing it. Then similarly, any blood loss from anywhere in the body, in the throat, in the cough, in the urine, in the stool, even if a single time there is a bleeding from any of these sites, don't ignore it. It may not be always cancer, but it may be something else which you need to find out.
Right.
So weight loss, fever which is not going away, prostate related urinary symptoms, frequency of urine, you're waking up several times in the night, difficulty passing urine. So these are the signals which we do get. There is less awareness, so people don't think about these symptoms as important. Because our natural tendency is only if it is painful, then you run to the doctor. If it's a tooth pain, then we will run to the doctor. But a breast lump, which is 1,000 times more dangerous, right, than a tooth pain, we will not go to the doctor because it is not bothering. We'll postpone it till the next.
Right. But let's talk about family history because then that, of course, increases the chances of one getting cancer. What would one do when they have a history of cancer in the family?
Okay. So if you have a family history of cancer, you know that at least you need to be more aware than the average other person next to you. Okay. So you at least get information that, say I had breast cancer in the family or a prostate cancer, so I should know the symptoms first. That's the very basic start. Okay? Then you should know from what age you need to start screening for that. There are screening tests available for certain cancers. Then you can see a counselor, or if a genetic counselor is not available, you see your doctor or an oncologist who will advise you if there are certain special tests for people with very strong family history. So if there are many members in the family, then there may be some major genetic mutation which can be tested for.
Right.
So these are the things that can be done for a family history.
But there's also a lot of information out there about cancer, a lot of differing information out there about cancer. And Maj, I'm sure working with cancer patients and being in this industry, you've heard quite a lot of this. So when it comes to food, for example, there are those who say coconut oil is very healthy, but a very recent report released says coconut oil is actually as unhealthy as red meat dripping with oil. So there's a lot of differing information out there. So where does one really ensure that the information they're getting is correct and healthy for them?
What we normally do at Apollo Information Center, we give out the information. If patients will contact us, we'll give them the publications, even from Dr. Chiraksha. We'll ask questions, they'll come, they'll find out exactly what they need. Most people don't have that information ready at hand. Or if they feel like, someone has cancer, so it becomes, some people say it's taboo and all that. So if they come in good time, we get the information, we get the medical reports from their treating consultants.
Right.
We'll send them over to Dr. Chiraksha. He'll be able to sit with his team, discuss to see how best we can be able to go with that case.
Yeah, but then that would be in the case of when one has been diagnosed with cancer, or one is suspecting they have cancer. But in the case of preventing cancer, many turn to all these healthy lifestyle options, and many of them have differing ideas out there. Dr. Chirag, help us. Where do we start in verifying this information?
So let's get the priorities straight. Okay. So what I would advise is that, again, first think of your grandparents, what they did. Don't try to pick information from social media, from internet,
Especially
Google. Yeah, so stay away from Google Doctor. The idea is that first you cannot copy a lifestyle of Europe, US or India. You have your own lifestyle based on your region, your culture, your upbringing and your genes. So you need to focus on that, and then you need to remember the big things: low fat diet, okay, less processed meat, less meat in general, more vegetables. In case of meat, the red meat should be less, okay, then less alcohol, and more exercise. So those are the big things. If people can remember, that is a good start. Then there are all these finer points which is more for the doctors and scientists to keep on debating and planning. So coconut oil, for example, is a huge thing in South India, and it would be very difficult to believe that it is unhealthy for them. But it may be unhealthy for somebody in whose upbringing it has not been a part. So The idea is we have to go to our roots. You cannot copy things from India, Europe, US, anywhere.
All right. All right. Let's focus on cancer treatment now, because I'm sure there's been a lot of innovations in the field. There's been complaints previously, especially when it comes to chemotherapy and the effects that it has, the side effects, and many saying in terms of convenience and safety, it really isn't the best method of treating cancer. So what kind of innovations are there now, especially with Apollo Information Center? Because I understand it links Kenyans, especially with cancer, to better medical treatment. What kind of innovations are there that provide convenience as well as safety?
Okay. So chemotherapy, about 40 years ago, there were maybe 20-30 drugs, and now there
Per
are
day?
No, there were 20 to 30 total types of medicines to treat cancer. Now there are 200 types of medicines,
Right.
out of which the majority are either given by mouth, oral, or they are given in daycare. So you don't need hospital admission, which was a big thing before, that everybody with chemotherapy had to be hospitalized. But now 90% of chemotherapy is given in daycare setting. The bigger side effects of chemotherapy, like lot of vomiting, which is now very rare. So with the excellent supportive care improvements, now we rarely see big vomiting issues. 95% of people would not have vomiting. Okay? So those are the big changes. Then there is the other supportive care improvement is the preventing low blood counts. This allows us to make chemotherapy much safer, able to give bigger doses, get better results, and yet less side effects.
Let's focus then on the link that Apollo Information Center helps Kenyans. What really does it do?
What we normally do, if a patient will come to us, they'll give us the medical reports from the treating consultants here. We'll forward them onwards to Apollo, and they respond with the quotation, the treatment option, and the duration of stay. With those three factors, they'll be able to plan better, even with the families back home. Yes.
I mean, in terms of options, because I'm sure that you meet many different families. There's cost constraints as well. There are those that simply cannot afford this cost. So what options are there from Apollo?
We have, here in Kenya, they normally use insurance companies, most of them, because we work with a lot of insurance companies. Others do fundraising, and we try to see how well best we can be able to reduce the cost, depending.
Right.
Yes.
Right. Talk to us about your current campaign on the prevention of cancer, because just this week you also had a seminar with Dr. Chirag where you're talking about cancer awareness. But what more do you do in contributing to this fight?
What we are trying to do, we are having a Cancer Can Be Cured campaign. We are going to give out 100 books to 100 families. We'll do a random pickup. What people need to do if they're watching, they send us an SMS or they can WhatsApp us. The numbers will go around the screen. I can say them?
Yes, please.
The numbers are 0719 581 035.
Just repeat that.
0719 581 035.
All right.
So we will randomly pick 100 names and we'll send the books to them.
So what is this book about?
This is on how to prevent cancer and how you can be able to manage it.
All right.
Yeah.
So, of course, a book that can help many people, Dr. Chirag, but let's talk more about those major forms of preventing cancer, especially when it comes to the trends seen for the major types of cancer: cervical cancer, prostate cancer, and breast cancer especially. Let's begin with prostate cancer among men. I understand in Kenya, the bigger problem with treating prostate cancer is first of all, the method of testing or screening prostate cancer turns a lot of men away. Has there been any changes in ensuring that there's better screening methods that are not as invasive?
Right, definitely. I think it's a very good question because in a large-scale screening, the convenience of the test is very important. So the blood test PSA, prostate-specific antigen, is a simple blood test. So there is no examination. Just doing this once every year after the age of 40 to 50 is a very important screening test, and it will identify majority of prostate cancers in early stage. And then once it shows sign, then you need to do the other test. But so general population does not need to get through an uncomfortable screening methods.
Right. And then, of course, when it comes to breast cancer, cervical cancer, they're also among the major forms of cancer, especially cervical cancer in the country. What, first of all, could be attributed to this rise of cervical cancer in Kenya?
So, specifically HPV, human papilloma virus infection, is the 95% cases that is the reason.
Right.
And the reasons for HPV, how you acquire HPV, is through sexual contact. So, early sexual contact, multiple sexual partners are the big reasons for, in general, HPV infection.
Right. There's been a lot of questions surrounding the use of the HPV vaccine, which was introduced not very long ago. There's very blurred lines as to who should use it, first of all. Should it be for children among a certain age? Should it be for those who are already sexually active? Who should use this vaccine?
Okay. So this vaccine is before you acquire HPV infection. So in short, it has to be before you become sexually active, or before you have had multiple encounters. That way you can prevent the infection. Once the infection has occurred, the vaccine does not work. So the ideal age is between 9 to 14, 15 years. With older the age, the efficacy goes down. And after the age of about 20, 25, it is very unlikely to have a major impact.
All right. I'd like to focus on something that came out from the Cancer Awareness Forum that you had this week, and this is with regard to, the stem cell transplant. That is another method of treating cancer. Talk to us about that and how available or accessible it is for the common Kenyan.
So stem cell transplant is the a very, very latest method in the field of cancer, but it is limited to the blood cancers. So it is mainly for the acute leukemias, acute myeloid leukemia, acute lymphoid leukemia, multiple myeloma, and lymphoma. So these are the big cancers which are treated. Apart from that, you can treat sickle cell disease also with that, but that's a very different topic. So these are available even in India in few select places only. It requires a big team and a lot of laboratory support. However, there is no surgery involved in this. This is a stem cell transplant, means you are giving certain medicines to the patient and then injecting stem cells through the blood. So in this whole process, there is no surgery, no operation involved. As of now, it is not available here to my knowledge, and we have probably the biggest number of people who travel to India for a very specific purpose is for stem cell transplant.
All right. True. So that being said, let's talk about the eradication of surgery as a means of treating cancer. This is also something that you addressed in that same in that same forum. Are we likely to see surgery replaced as a form of treating cancer?
It's a very, very important point. I think a lot of people are worried about big surgeries. And when it comes to cancer surgeries, unfortunately, many times they have to be big because you have to remove the area around the tumor also where it can spread. So for some of the cancers, it is very well established that you can do away surgery, and only combination of good radiotherapy and chemotherapy can cure that cancer completely. And that is very well established for last about 20 to 30 years for cancers of cervix. Okay? So cervical cancer in the majority of the world is treated with chemoradiation for about 30 years. Then comes lot of the tumors of the head and neck region, the throat, the tongue, etc. the esophagus, the food pipe, the lung, and some of the bladder cancers and rectum cancers. So these are areas where otherwise the surgery is either big or functionally or cosmetically a big problem. And there, this chemo and radiation combination has made it so much better.
All right. So, so just talking about again accessibility of these different options to Kenyans through the Apollo Information Center, Maj, what kind of information and advice do you give to patients who are traveling to India for treatment?
They have to know exactly, they should not take time when they've been told maybe you're stage 1 or 2, they should not take time and say, oh, I can still prolong it, because when you go there, it will be worse. They should act then. Even as Dr. Chirag said, because it normally spreads.
It spreads very fast.
Yeah. Very fast, yes.
Again, do you offer options for those who cannot go as fast because of cost constraints?
We try to have Skype chats or Skype calls with Dr. Chirag, now with the patient. We'll call him from India. Then we'll try to see, Dr. Chirag will try and advise them on how they can be able to travel and to manage it.
Right.
Yeah.
So then maybe just to add on to that, Dr. Chirag, for those who really cannot afford it but have already gotten into contact with you, do you turn them away, or what means do you use to help them?
So there are a lot of ways the Apollo management in general tries to help them. So one of the big thing now reducing the cost is outpatient care. So since the advances in oncology has allowed lot of outpatient treatment, including chemotherapy, even for example radiotherapy is completely outpatient treatment. Even surgery, the hospital stay has reduced a lot than in the past. So all those things have reduced the cost to a large extent. And on top of that, the management helps needy patients on an individual basis by going into their details, talking to them, and figuring out how they can help. Even sometimes midway during the treatment. So for example, leukemias, many times it's a long treatment, 4 months, 6 months, like that. So patients who come may be okay initially, but in the middle of the treatment, they have financial constraints. And then the management again pitches in and helps them out.
All right. Let's focus on beating cancer before we wind up, because we can prevent cancer. But for those who have already got cancer, how can you beat it? Other than the medication that you're taking, lifestyle again plays a very big role. Where should one begin in terms of diet, in terms of routine, in terms of the amount of sleep you should get? Talk to us about that.
So once somebody has a cancer, I think the most important thing is to first accept the fact that a lot of cancers are being cured, because that's the starting point. If you are going in with a belief that you will come out winner, then your chances are always better. Okay? So that's the big thing. The second is follow all the advice given by the doctor and the nurses team, because they know better, and don't try to change things on your own way. For example, you read on the internet that, okay, don't take any sugar.
Stop.
Now, don't take any milk product. Now, when somebody tries to do that in the middle of the treatment,
at some point you realize you have nothing to eat when you follow all those rules.
Exactly.
Then they lose weight, they become weak, so they cannot follow the treatment through. They must realize that these are not proven reasons yet about sugar or any of these things, and that the cancer happens over a period of several years to few decades. So it's not that you change your lifestyle now suddenly for few months and it is going to make a big difference. So right now the focus should be on maintaining energy, maintaining weight, and getting through the treatment. So that's the most important. And the third last point is that during those treatment period, please don't try to learn from internet. At that point, your learning focus, your point should be doctor and nurses who will give you right information. And if you want to read more, you go to very official websites of cancer organizations, which will have authentic, balanced information.
Right, and of course the Apollo Information Center, very, very generous with that information. But even more concern is pregnant women or pregnant mothers who have just been diagnosed with cancer, and many times you don't know what to do. And many times the medication itself becomes an issue. Is it going to affect the baby? So where does one begin if they're pregnant and have been diagnosed with cancer?
So it's a very highly technical question. So we'll not go in too much detail.
Right.
But depending on the cancer, there are ways to treat. It also depends on which stage of pregnancy you are in. So in the first trimester, first 3 months, we avoid majority of the medicines. But in that time, a medical termination of pregnancy, abortion is possible, which would be the best way. In the second and third trimester, you will be amazed to know that majority of the chemotherapies can be given very safely. It's very surprising to most people.
So without affecting the baby?
Without affecting the baby. Okay? So majority of the tumors can be treated at that time. You cannot do the radiotherapy. So that has to be done after the pregnancy. But in general, there are good ways to treat majority of cancers during pregnancy. It requires certain planning and proper choices of treatments, but it is very much possible.
Right, and finally, of course, cancer for infants and children. I don't know if there are any who are born with cancer, but basically babies with cancer. It's also a very sensitive topic with regard to the kind of treatment they should get, whether they should be exposed to that kind of radiation to begin with. So what options do parents have?
Okay, so we had somebody ask the same question during the awareness talk, and my answer was that the priority should be very clear. Okay? The only way to cure cancer today that we know of in a scientific manner is through the use of chemotherapy, radiotherapy or surgery. So when we are talking about the side effects, one must not forget that if you don't go through this treatment, the cost is life. Okay? So I gave the example that if you are in a jungle and the lion comes close and you are not wearing your shoes, there are thorns on the road, the stony road, you are not going to worry about the side effect of running on that road. You run.
True.
Right?
Right.
Your priorities in that split second are so clear. Right? Similarly, in this time, your priority should be very clear. That first you have to save yourself from cancer, and that is possible only by proven standard treatments. Fortunately, children cancer, the cure rates are excellent. So on an average, in children cancer of majority types, about 80% cure is possible. Okay? So even though we don't know the reasons, even though these concerns of giving such treatments to children, the most important message is that the cure rates in children are excellent.
All right. Thank you so much for speaking to us. Of course, as you shed more light on cancer and continue with your campaign against cancer, thank you so much for speaking to us. We've been speaking to Dr. Chirag Shah, who is a cancer specialist from Apollo, as well as Maj Kariche, who is the director of the Apollo Information Center. They are running a cancer campaign in the country. We'll post their number on our Twitter page at KTN News. I'll also post it on my personal Twitter page at Michelle Ngele. They will be giving out a free book, a free manual on how to prevent cancer and how to beat cancer if you're already living with cancer. So do stay tuned for that. But that conversation brings us to a close here on Weekend Express. We thank you for watching. My name is Michelle Ngele. I'll see you shortly at the top of the hour with more.